This segment of DelmarvaLife is sponsored by TidalHealth Home Care.
Managing all aspects of diabetes can seem like a laundry list of different challenges: education, nutrition, therapy. Seeking out the help of a medical profession when managing such a complex and varied disease can provide untold amounts of relief.
The good news is you don't always have to drive around town looking for somebody to render aid. You can get help in the comfort of your very own home. Here to explain that very thing is Jessica Lewis, who is the Clinical Manager of Quality and Education with TidalHealth Home Care. Thank you so much for joining us.
Welcome.
Thank you for having me.
I'm going to ask you a great big question right off the bat. Why is diabetes such a hard thing, a complicated illness to try to manage?
Because it can affect so many different things. You know, if a patient with diabetes and it's uncontrolled, it can affect your heart, it can affect wounds, and it can affect your kidneys. So it makes the whole disease process is very complicated.
And so obviously education is key.
Absolutely, absolutely. And we provide in-home education, our nurses one-on-one with the patients, and it's very specific to the patient. So if they have insulin or medications, or they need to check their blood sugar with their meter, they don't know how to do it, we teach that in the home.
Oh, you do all kinds of things with that.
Absolutely.
So why is it so important to do it in the home?
Patients are comfortable in their own home. You know, they learn better, we see a better outcome. You know, in the hospital, it is a lot of information in a little bit of a time.
Okay.
Where when we provide it in the home, we can expand that education over a longer period of time and really help them understand how to manage their diseases.
And it's not just managing their insulin, and it's nutrition as well.
Diet, exercise, absolutely. So we follow programs. We have a diabetes program that we follow, and our nurse and physical therapist work in tandem with the patient to ensure that they are eating properly, they are checking their blood sugars, they're taking their medications, whether it be insulin or oral pills. And then the physical therapist works on the exercise part of things, because exercise is very important when you have diabetes.
Oh yeah.
So is the diabetes program in full swing now?
Absolutely, it sure is. Yep, it's our 5th program that we have in full swing.
Wow.
So what has the response been like?
So far, it's been really well. Our patients really like the, you know, the education that we can provide to them where they understand it. You know, our nurses are phenomenal at the one-on-one, and patients just respond better to one-on-one.
Is this something that you can be contacted directly for, or does this need to refer through the doctor? Or?
We typically have the doctors refer. They can reach out to their primary care or a doctor that they're comfortable with. Sometimes even if they're in the hospital, they can request us. If they have already been on service with us, they're more than welcome to call us, and we can always help facilitate it.
Figure that out.
Yeah.
Wonderful. Such a wonderful service to have.
Yes, absolutely.
TidalHealth Home Care, Jessica Lewis, thank you.
Thank you.
For joining us this afternoon.
Thank you.